You're about to hear something every person with high blood pressure should know, but almost no one ever explains clearly. Every single day, millions of people swallow Losartan and Amlodipine without fully understanding what these medicines are actually doing inside their bodies. They trust the prescription, but the real effects often remain hidden. Today, we break that silence. In this video, we uncover 9 major effects of Losartan and Amlodipine, backed by the latest medical research. Not just the benefits you expect, but also the surprising changes happening in your heart, blood vessels, kidneys, and daily life. This is the real science, explained simply, so you can understand what your medicine is truly doing. 1. They crush high blood pressure, but not the same way. Losartan and Amlodipine both lower blood pressure, but they do it in very different ways. That difference is why using them together can be so powerful. Losartan blocks a hormone that tightens blood vessels. Amlodipine relaxes the muscles inside the vessel walls. When both actions happen at the same time, blood flows more freely and pressure drops more steadily. Research shows that patients with difficult or long-standing hypertension reach their target blood pressure more often with the combination than with either drug alone. This isn't a small improvement. It's the difference between unstable numbers and consistent control. Imagine checking your blood pressure day after day and finally seeing it stay in the safe range. That consistency matters because every spike in pressure silently damages arteries. Over time, those tiny injuries add up, increasing the risk of heart attack and stroke. Lower, stable numbers mean less stress on the entire cardiovascular system. This is why doctors often choose combination therapy when one medicine is not enough. It's not about stronger drugs. It's about smarter control. 2. Faster pressure control. Not weeks, sometimes days. Many people think blood pressure medicines take weeks to work. That's not always true. Studies show that when Losartan and Amlodipine are used together, blood pressure can drop faster than with a single drug. In some patients, especially those with very high readings, improvement begins within days. This speed is important. High blood pressure is not harmless while you wait. Every day with uncontrolled pressure increases strain on the heart, brain, and kidneys. Faster control means less ongoing damage. Think of it like stopping a leak. The sooner you fix it, the less harm it causes. Patients often report feeling better sooner too. Fewer headaches, less pressure in the head, and better sleep. Quick improvement also builds confidence, making people more likely to continue their treatment. However, fast drops must be monitored. Blood pressure that falls too quickly can cause dizziness, especially in older adults. That's why medical supervision matters. The goal isn't just speed. It's safe, steady progress toward healthy numbers. 3. Huge impact on heart health. Lowering blood pressure is only the beginning of what these medicines do for the heart. When pressure inside the arteries drops, the heart doesn't have to work as hard to pump blood. Over time, this reduces thickening of the heart muscle and lowers the risk of heart failure. Clinical studies consistently show fewer major cardiac events in patients whose blood pressure is well controlled with drugs like Losartan and Amlodipine. This means fewer hospital visits, fewer emergency situations, and longer, healthier lives. The heart is a muscle, and like any muscle, constant overwork causes damage. High blood pressure forces the heart to push against resistance every second of every day. Reducing that resistance gives the heart a break. This isn't just a theory from textbooks. It's a real, measurable reduction in heart attacks and heart-related deaths. Many patients never feel this benefit directly. They don't feel their heart being protected. But years later, that silent protection can be the reason they are still alive. 4. Stroke risk drops. Sharply high. Blood pressure is the strongest risk factor for stroke. It weakens blood vessels in the brain and increases the chance they will burst or become blocked. When Losartan and Amlodipine bring blood pressure under control, that risk drops dramatically. Studies show that patients with controlled blood pressure have far fewer strokes than those who remain untreated or poorly controlled. This benefit is not subtle. A stroke can change a life in seconds: loss of speech, paralysis, or even death. Preventing even one stroke is a massive win. Combination therapy is especially useful for patients who struggle to control their pressure with a single drug. By keeping pressure stable throughout the day, these medicines protect delicate brain vessels from constant stress. Many people focus only on heart attacks, but strokes are just as devastating, if not more. The scary part is that high blood pressure rarely causes symptoms before a stroke happens. That's why control matters even when you feel fine. Prevention is happening quietly, every day. 5. It protects your kidneys. 2. Most people don't realize that high blood pressure slowly destroys the kidneys. The damage happens quietly, over years, without pain. Losartan plays a special role here. It has been shown to slow kidney damage, especially in people with diabetes or early kidney disease. It reduces pressure inside the tiny filtering units of the kidneys, protecting them from scarring. Amlodipine supports this effect by improving overall blood flow to organs. Together, they don't just treat blood pressure, they help preserve kidney function. This is critical because kidney damage is often permanent. Once function is lost, it rarely comes back. Many patients only discover kidney disease when it's already advanced. Using the right blood pressure treatment early can delay or even prevent that outcome. Think of it as protecting your body's natural filters. This benefit doesn't make headlines, but for many patients, it's one of the most important effects of these medicines. 6. Some patients respond way better than others. Not everyone responds to blood pressure treatment the same way. Genetics, age, lifestyle, and other illnesses all play a role. Large clinical trials show that more than 90% of patients reach their target blood pressure when using Losartan and Amlodipine together within about 8 weeks. That's a huge success rate. For people who struggled for years with unstable readings, this can feel life-changing. Suddenly, the numbers make sense. But response varies. Some people improve quickly. Others need dose adjustments or additional medicines. This is not failure. It's normal. Blood pressure control is not one size fits all. The key message is persistence. When patients stick with treatment and follow up regularly, outcomes improve dramatically. Doctors use response patterns to fine-tune therapy. The goal is not perfection overnight. It's steady improvement over time. And for most patients, this combination provides a strong foundation for long-term control. 7. But side effects are real and different. These medicines are effective, but they are not free of side effects. And the effects are different for each drug. Losartan can sometimes cause blood pressure to drop too low, leading to dizziness or weakness. In rare cases, it can increase potassium levels, which affects heart rhythm. Amlodipine commonly causes swelling in the feet and ankles. This swelling can be uncomfortable and worrying for patients who don't expect it. These effects are not imaginary. People feel them in daily life. Some stop their medicine quietly because no one warned them. That's dangerous. Side effects don't mean the drug is bad. They mean the dose or combination may need adjustment. The important thing is communication. When patients report symptoms early, doctors can respond safely. Ignoring side effects or stopping medication suddenly creates bigger risks than the side effects themselves. 8. Some people do better with one than both. Despite the benefits of combination therapy, it's not ideal for everyone. Some people tolerate one medicine better than the other. A patient might feel dizzy on Losartan, but fine on Amlodipine. Another might develop severe ankle swelling with Amlodipine, but feel stable on Losartan alone. Older studies and real-world experience show that individual tolerance matters. This is why personalized treatment is so important. Medicine should fit the patient, not the other way around. Doctors often start with one drug and add another only if needed. The goal is balance, effective control with minimal discomfort. There is no shame in adjusting therapy. What works perfectly for one person may be uncomfortable for another. Listening to the body and working with a doctor leads to better long-term success. 9. Missing doses can be dangerous. One of the most shocking facts about blood pressure medicine is how quickly things can go wrong when doses are missed. Especially with amlodipine, blood pressure can rise again within 48 hours of skipping pills. Many people think missing a dose here and there doesn't matter. It does. Sudden spikes in blood pressure increase the risk of stroke and heart attack. The body adapts to the medicine. When it's suddenly removed, pressure rebounds. This is why consistency is critical. Taking medicine at the same time every day protects against dangerous swings. Blood pressure treatment is not when you feel like it. It's a daily commitment. Alarms, pill boxes, and routines help. Consistency is not about discipline. It's about survival. Losartan and amlodipine save lives. They protect the heart, the brain, and the kidneys. But they also interact with real life. People respond differently. Side effects happen. Doses change. That's normal. Never stop or change medication on your own. Ask questions. Report symptoms. Stay informed. Because understanding your medicine is one of the strongest tools you have to protect your future.